viewpoints. And now moving to the next panelist, I am delighted to introduce you to Mr. Manoj Garg. Manoj is the CHRO and Head of International Business at Dr. Lal Path Labs. He has over 25 years of experience in HR strategies and operations for organizations across geographies. He has worked for organizations like Bharti Airtel, Dell, ST Microelectronics, and Asian Paints. He is an alumnus of Accelerite, Jamshedpur, and NIT Kozhikode. Manoj, I will like to address this question as you are one of the COVID warriors. So since the beginning of the pandemic, the workforce at Dr. Lal Path Labs has been on the fields testing, collecting, and providing samples, putting their lives on risk. What were some of the challenges faced by the operations teams during the second wave of pandemic? And what are some of the best practices? What learnings you carry, which you would like to share with the participants to ensure the physical and emotional well-being of employees to strive and thrive through this pandemic? So over to you, Manoj. Manoj, you are on mute.
Right.
Yeah.
Actually, before talking about the wave 2, I just wanted to talk to a little bit about wave 1 as well, because for us as a testing organization, this has been a continuum for the last 15 months. This is more like a new normal. What happened, in the first wave? I think the lockdown was very sudden. None of us were prepared. I can very safely say that in my lifetime, I haven't seen a scenario like this before, where on the roads there is absolutely no vehicle, pin drop silence across, and so on and so forth. So it was sudden, and all the policies, the local administration, everyone was coming out with some or the other restriction or opening. And I still remember on the WhatsApp messages, we were getting every state, every district administration's notices. So the biggest challenge at that point in time for us was to how do you really keep your business running? How do you keep your outlets open? How do you really ship samples? How do you collect samples? Virus was completely new. All our employees, including myself, we were really scared. Nobody knew, what would be the real impact. So, it all started off with a lot of chaos, both logistics, running the operation, keeping the organization, open for business. Then once we got out of that in a couple of days, we started to look at as to what are the challenges in front of us from a business continuity perspective. First and foremost, we needed to train close to 1,000 people for collecting these samples. How do you train people when everything is locked down? So we used digital training medium. Most of the time, medical training is show and tell in person. Now these are all very, let's say, intensive procedures. But we had to do that. So we did training online through mobile videos. We had to bring all the samples to Delhi because our testing facility that time was in Delhi, and government was giving certifications for each lab. How do you really, have a logistics during the lockdown when no flights are running or very few flights are running? There are no trains, no buses, nothing. How do you really ship samples across the country? And obviously, the various customers across the country. So we are present in all states and almost 250 cities. They were expecting us to provide the testing services. So logistics challenges were there. Navigating the state-specific regulations, disruptions to operations are happening. Police did not know whom to stop, which is essential service, what is not essential service, is diagnostics an essential service or not. In fact, people were stranded without ID cards, let's put it this way. And so getting all that curfew passes was a big challenge. Protecting and motivating staff to collect samples was a big effort in the first 3 months. How do you really convince people that the N95 mask, the PPE kit, which is being provided, is going to protect them, is going to protect their families? I have witnessed those scenarios where employees were asking us, saying, we don't want to go back home because we might carry this virus to our families. So can you put us up in hotels? There were no hotels which were open. So it was a very, very different kind of a challenge in the phase 1 or wave 1, what you can call it. So we had infections in the team that time, but predominantly they were all in the front line. Couple of people got infected, but they recovered quickly. Luckily, we did not have any fatalities at that time as well. So we were able to manage our operations with fewer days of localized disruptions here and there. Things went like this till October, November, and suddenly the numbers started to come down. From November to February, it looked as if there was no COVID. Samples, testing volumes came down, and pretty much we started to do the next year's budgeting and planning, and we did not know how to anticipate or what to anticipate for the next year in terms of specific COVID infections. And then came the second wave, which is what we all are aware of. Now, this time around, what took us by surprise was the intensity of the wave. I guess earlier panelists also spoke about how exactly the number of infections went up, how much hospitalizations went up. But as an organization, we were probably better prepared. And let me speak about few positives of the period between, let's say, March and June, which we'll probably call a second wave. I think our frontline employees were not scared any further. We did not have to fight the fear battle. In fact, pretty much everybody had seen this happening over a period of so many months. People had immense confidence that company is doing enough to protect and take care of their well-being. And I'll talk a little bit about what we did. The other positive was that a large part of our workforce was already fully vaccinated. Thanks to the vaccination prioritization program by Government of India, in the month of January, all frontline healthcare workers were given vaccination opportunity. And that again had a very positive impact on the morale of our employees. By this time, we moved from just one testing location to more than 13 testing locations. How this is important? From a logistics standpoint, we didn't have to really ship samples from all across the country to one location in Delhi, but we were able to test the COVID samples from 13 locations in various major states. We also had our staff now covered under health insurance, term insurance, etc. So there was an adequate psychological safety in the minds of our workforce. Now that's the positive side of the equation. But on the business side, what we noticed was that the demand for testing shot up to very high levels. The other piece was that there was very high concentration of cases initially in one or two states, but then it spread very, very rapidly across the various parts of the country. While the ratio of infection to hospitalization may have remained the same between, and I don't have those statistics, but I'm saying that maybe it is the same between the wave 1 and wave 2, but the sheer number of infections which happened in wave 2 led to far more hospitalizations. Now, with hospitalization came many other tests which were being recommended by the clinicians, which we call them as allied COVID tests. So while the organization was very well prepared to do RT-PCR testing in many locations, we did not anticipate as much demand for the COVID allied test. And I'm sure you all must have heard of these names like D-dimer, IL-6, and so on and so forth. So there was again a lot of demand for such tests. A lot of people were asking for home collection. Unlike phase 1, where we did not have too much of stress on home collection, this time around in phase 2, we saw that we ran out of capacity to really service every demand. Our call centers were experiencing almost 4 times the call volume, 5 times the call volumes. Same was for home collection. So in this phase 2, when in phase 1, while we were struggling to keep our outlets open, manage logistics, in phase 2, our challenge was how do we really quickly augment capacity? And we hired almost 250 people in less than 3 weeks just to augment that capacity so that we are able to service our patients. In wave 2, we also noticed that on the staff side, we started to see some infections, not only on the front line, but also in the middle layer, as well as people who are doing coordination jobs. The other characteristics which I think we spoke earlier about was that this time in wave 2, a lot of families also got impacted. A lot of people lost their loved ones. Obviously, that also had an emotional toll on our employees. And all this, let's say, created a kind of a challenge for us to service the demand which was coming in. We hired almost 250 people, but I could very easily say that despite that, we had a challenging 6 weeks where we were trying to manage the operations on one side with people working more than 14 to 16 hours, and on the other side, patients continuously anxious and requesting reports on time. So that's the wave 2 for us, and it is probably still continuing a little bit here and there. But how did we really cope as an organization? What did we do in last 15 months to run a healthcare service delivery organization? I would say the efforts could be classified in 5 buckets. First one is health and safety. Second one is rewards and recognition. Third is work practices. Fourth is financial safety / security. And last but most important is the connection, communication, and emotional well-being. Let me quickly elaborate each one of them. First and foremost was health and safety. We are a testing organization, so we were, we could make COVID testing free for all. All our staff, all the allied tests were free for all. We had assisted pickup, home collection pickup for our staff. We prioritized them because if they are not well, then they cannot serve the customers well. So we took that view. We created a COVID task force dedicated to help employees, which I think most of the organizations did. Oxygen concentrators, support to employee families, all that we did. We also initiated a free doctor consultation because at that time, getting right advice was becoming very challenging. Paid leaves for infection. In fact, even till date, we actually are not asking and not tracking anybody who says he's COVID positive. No questions asked, and a person can stay at home. When they feel comfortable, they come back. So we really created an environment where people could feel, comforted. Health and safety was taken care of. All our locations, being medical locations, obviously the sanitization protocol and all the safety gears was always provided. It is not something which we did for COVID. It is done throughout. It's part of our business. On the rewards and recognition, we instituted right upfront in the wave 1 itself ways and means of rewarding people. We had a very successful campaign of LPL heroes running on various social media channels. Facebook, we have a closed Facebook group. emails. We published stories of people going out of the way to service the customers. And what at least one learning I've got is that actually people in healthcare take pride in serving customers, and there is no better reward for them when they're able to execute something like this. And our whole organization really rose to the occasion at that time. We had regular connect calls with leadership team. We had e-certificate distribution, incentive programs, and a whole host of things which were done to ensure that people are motivated and they feel recognized and rewarded. On the workforce practices, I think we also implemented for roles which were not customer-facing roles, work from home, flexible working benefits, employee returning back to work. All safety protocols were informed to them, they were trained on it, and they could come back to work based on the requirements of theirs.
We need to wind up.
Yes. And I would then probably talk about the connect and support. So we ensured that right from the chairman to MD to CEO, everybody was having very, very regular calls with frontline employees, with the middle management. We had employee loan schemes, assistance programs. Again, for well-being, mental health, wellness, we had taken a partnership with one of the leading wellness organizations. They conducted seminars, and we ensured that people have help around when they needed it. And I think these are probably some of the things which helped us keep the motivation, morale, and enthusiasm of our organization up. And we are continuing to support all our customers to best of our capabilities. So these are a few things which we did as an organization.
Thanks a lot, Manoj. And I think I have personally used the services, and many of the participants and panelists also must have used the services. I think Dr. Lal Pathlab have done an extraordinary job, because the first wave as well as the second wave, there was a lot of requirement. The testing capacity had to be enhanced significantly. And I think you lived up to that expectation. So really, you people have been on the front line and helped in saving a lot of lives. So thanks from all the panelists and participants. Over to you, Sakshi.
Thank you, Mr. Manoj, for the points which you emphasized. I think very important is empathy towards people, towards employees, which actually turns into rewards and recognition for customers also. Thanks a lot for the